Hi there, I'm Dr. Chung and welcome to your friendly proctologist. Thank you so much for being here. I hope you're dealing the best that you can. We're going to continue our series on anal spasm. Last time we talked about 10 signs and symptoms where you might have anal spasm, even if you didn't check all the boxes. This video today is going to be to explain how the spasms come about and how they are working with you, okay? Or how they keep happening. It keeps going on over months or years. The last video is going to talk about the treatment or my formula for treatment of anal spasms. And I know, you're thinking it already. You're like, Dr. Chung, all you do is like to talk. You just want people to view and all this stuff. You just want, your subscriber count to go up. Give us the treatment already, would you? I mean, come on, how hard is that? And let me tell you this. This is what I do with all my patients when they're in the consultation with me. So let's talk about if I just gave the treatment video out to you first, okay? Compare that with the doctor that you're already seeing now. What happens? They tell you the diagnosis, you got hemorrhoids. Okay, then what do? They tell you the treatment. They say, do sitz baths, take a high fiber diet, but sit on a soft cushion. Maybe you need surgery. And then what? They say, see you later, sir or ma'am. Have a good day. So they gave you their treatment, but how come you don't feel better, huh? How is that possible? So listen to me, okay? Just trust that I know what I'm doing, okay? This part here is what's missing with your doctor, is that we talk about every one of your symptoms. I actually explain every single one of your symptoms and why they happen and what it is that you're feeling that you can't even say with words, but I can explain to you what's going on. Tears come down at this part of the consultation because finally someone's listening to you and understands what you're going through, and therefore, because I know what the problem and the real diagnosis is, you are now convinced that the treatment I'm going to tell you next actually just might work. Okay, so if you're not interested in this, go ahead, click it off, find the video that's coming up later on, and we'll get going, okay? So, the causes or why stuff happens. It's a physical thing and a mental, psychological thing, okay? And the physical thing is pretty obvious. You can kind of see that if you had, for example, a big hard poop and it shredded your anus like shredded cheese, okay? You're bleeding, you got pain. What's going to happen is your brain senses that, your anus senses that there's a reflex that happens without you even doing anything. And it clenches and closes that gate down, right? It wants to protect you and itself. It doesn't want anything to go in or out ever again. It definitely does not want to experience that pain ever, okay? And sometimes it could just be that one time that creates that spasm that just doesn't want to let go. Other people, it takes several more incidents, maybe a few times a week or several times a month, and all of a sudden now they've got the spasm issue, right? Other people, it's a very much a traumatic event, okay? And let me just say this, that I don't believe that any of us are born with anal spasm. It's all about how we are interacting with the world or what happens to us, okay? Some people, it doesn't have to do anything with the bowel movement. Other people, it's sexual abuse, rape, somebody examines you, like a doctor examines you, and they didn't do it very nicely. And so they jam their finger in it, and you're just like, what the hell? And that can give you anal spasm. I've heard of people getting prostate biopsy and getting anal spasms, okay? So even in a controlled medical setting, this stuff is very difficult to control. The other thing here is the psychological or the emotional aspect, okay? And this kind of gets into many different things with the physical. They tie together hand in hand, right? And when you get that pain, you are now afraid of pooping. You see all that blood. You definitely don't want to see that. You're very disturbed by it. Do I have cancer? Am I going to die? All these things with this mysterious bottom end starts to grow anxiety, starts to grow worry. And many people will hold their stress in their anus area. Okay, like some patients have actually told me, this is a real thing, I didn't make this up. When they have a stressful day, they'll take a break and they'll just kind of sit there and relax. And they notice that their anus is clenching like something, like it's holding on for dear life. Kind of make, another analogy is like you're sitting staring at a computer all day and all of a sudden your shoulders get so tight you didn't even realize how bad it was. But it's because you're so focused on your work and stressed out. That's what happens. Some people, it's a divorce. Some people, it's about losing a family member. Other people, buying a new house, starting a new job. And all these things, the tensions and anxieties grow, and that's just where we hold our stress. So again, the emotional impact of stress, I am a true believer in it. Very, very difficult to prove because we're all so different, hard to quantify that, but there is a true impact there. So when you have either of these or a combination of the physical and emotional aspect going on, you can see that as soon as the poop sensation starts to happen, the anus is starting to clamp down. You guessed it. It knows what's going to happen. It said, oh no, here comes everybody. Hunker down, get in your trenches, put your guard up. And that's exactly the last thing you want to do. So you sit down in the toilet and you're trying to see if things will happen by itself because you heard you're not supposed to strain, but there's a gate that's shutting down. Eventually you wait long enough, but you gotta push because you gotta poop. The rest of your GI system is pushing down. All the muscles are trying to push down, get this thing out, but the anus is staying stubborn and does not want to open. So you have to push hard, and it varies for some people. Some people push a little bit more. Some people, their eyeballs are popping out of their head. They're switching positions. But the force is necessary to open up that anus just little by little. If you can kind of see this gigantic thing, and the anus needs to stretch open and accommodate that big poop there, right? Or any poop, because it's very small. And when that poop is going by, the anus is squeezing so hard on the poop that even if it's soft, you may still get hemorrhoid irritation or fissures because the lining under our anus is so delicate, right? And then after the poop is done, what happens? Usually there's about a 30-minute kind of silence or things kind of calm down. But then afterwards, then people may complain of a burning type of sensation in their bottom end area. And that is the spasm starting to shoot up. The muscles that were irritated, they're saying, ow, and they're clamping down really hard. And the thing about the spasm is that when it clamps down, the pain goes up. When the pain goes up, the anus starts to spasm, okay? And therefore you had this vicious cycle that's revving up. Pain, spasm, spasm, pain, pain, spasm, and goes and goes. And sometimes people can have this pain for all day long, for 24 hours a day. Usually there may be some kind of cycling going on, ups and downs, but if yours doesn't last all day or just for half an hour or something, you are so lucky and so fortunate. I'm very happy for you. Another thing that can happen is because your anus is so touch and go, it's taking so much effort to open up. Sometimes that gate closes down so quickly because as soon as it gets a chance, the anus just goes, ha ha, great, thank God I stopped the flow. Now we don't have to suffer anymore. I don't want to go through that whole poop. I want to stop it as soon as I can. And so people may feel that sensation where it's like, oh my God, what the heck? Why did it stop halfway? I'm nowhere near done yet. And I'll give you one piece of advice right now. Get off the toilet. It is very difficult to restart that flow again. Just don't do it. But that's your muscle spasming down and saying, heck no, we're not doing this right now, okay? But after the poop is done, again, these muscles that are being used to poop, the levator muscles, the pelvic floor, the anus muscles especially here, and because they're already injured, okay, because they've been overused, they've been contracting for such a high, for a long period of time at a very high power level, they're going to get injured eventually. For example, Let's say you're doing a bicep curl and you're using a 500-pound weight and you decide to do this for 6 days in a row, okay? You're going to expect that bicep muscle to just give up, right? It's going to be so sore and so injured, you can't even lift a gallon of milk, let alone like a pencil. You oh my God, my arm, I can't do it. That is what your pelvic floor and your anus is saying to you. We are so injured, we are so scared, we're going to clench down, but we're so hurt right now. We try so hard we can't relax, but we're trying to do the best we can, but we're going to tell you that we're really hurt, and that's what that signal is. Now, the thing with the bicep muscle, the arm, is we can have good control of it, so we can tell it, hey, stop working, you're injured, don't kill yourself, relax, do nothing. With our anus muscle, the internal anus muscle specifically, it does not have that on and off switch that we are programmed to have, okay? And so we need to get training of it. We need to get control of it through exercises and physical therapy, which is what we're going to talk about in the next video. One more last thing I want to emphasize to you. Do not underestimate the psychological, the emotional, the portion of this condition, okay? There are incredible things that the brain is capable of doing that we simply do not understand at all. Don't underestimate the stress of your job, for example. It can definitely do this. Multiple family members being ill, and you're the sole caregiver. Do not underestimate that. I'll tell you about a patient that I saw who was sexually assaulted. And you would think this patient would have anal spasms, but guess what? The exact opposite occurred. The patient had no anus squeeze at all. It was completely gaping open. And it happened as soon as the assault started, okay? So some of these things where it's out of our conscious control, the brain works in mysterious ways. Trauma does incredible, powerful things to us that a lot of times, yes, the mind also needs healing as well as the physical muscle issue as well. It's not easy and it takes time, but I hope that this can give you some understanding. This is a huge topic. I try to compress it all into one little video. But the treatment video is coming up next, and some more things to expound on some of these things are coming up in the future. Again, thank you so much for being here. I hope you're dealing okay, and I wish you well. Bye-bye.